Desiree here. So today I want to talk to you about some long-held beliefs about addiction and maybe how some of the latest research in the addiction field might dispel some of those beliefs. We call them myths. And so some people enter into treatment for all various different kinds of reasons. Some people join these substance abuse groups because they're mandated to, or somebody told them that they had to be there, like an employer, a partner, the criminal justice system, whatever it is. And a lot of people are concerned about their substance use because they've suffered losses or other consequences that maybe make them want to consider changing. And maybe others don't see their substance use as a problem and they're not quite ready to make that change yet, as I talked about in the stages of change session. So, regardless of whatever the reason you go to treatment, the current research shows that there is a potential for some very good outcomes. So, there's a commonly held myth that unless somebody enters treatment freely and they're already motivated to change, they're not going to do well. But we know that that's not true. So Nora Volkow, she's a scientist who leads the National Institute on Drug Abuse, which is called NIDA. She said, we know now that the outcomes for those who are either legally mandated to enter treatment can be just as good as the outcomes for those who enter into treatment voluntarily. So I want you to think about, what does that mean for you now? Did you believe that they had to already want to change in order to be in treatment and for them to have success in it? Because what Ms. Volkow is saying is that's not true. Just because you showed up and you got the information, your outcome can be just as good as somebody who entered in voluntarily. So think about how that information influences how you feel about treatment. Another myth is substance users have to reach rock bottom before they can change. And although hitting rock bottom has often happened for people who enter treatment, there's no evidence that it has to happen in order for someone to recover successfully. So it's actually quite the opposite. The earlier on in the addiction process that a person gets the intervention, the longer they can lead a substance-free and healthy life. Some other commonly held myths: addicts are bad people, addiction's a willpower problem, addicts can't be treated using medications, addicts have to be punished, not treated for using drugs, and some people can't change. And we know that all of those are not true. So think about some of the other myths that you might hold, or maybe you heard in the past, or maybe you've thought in the past. What are your beliefs about those statements? We know that they're all myths, and so I want you to think about any discrepancies between what you believed or what you were told and the explanations that I'm giving you to refute the myths. So the first one is addicts are bad people. Well, we all know that they're not bad people. People who use or misuse drugs, they're not, or alcohol, they're not bad people who need to become good, or stupid people who just need to be educated. Rather, addiction causes changes in brain activity that can make change difficult but not impossible. Addiction's a willpower problem. This is based on that old belief of wanting to blame or shame people who have alcohol or drug problems under the moral model of addiction, but we're no longer under the moral model of addiction, and we know that addiction is a disease and it is changing chemical processes in the brain. So we know that it's a disease that needs treatment. So it's a process that occurs in the area of the brain called the mesolimbic dopamine system. And that system is not under our conscious control. Just like we can't consciously control our heartbeat, our digestive system, we can't control that mesolimbic dopamine system. And because there's changes to that where it automatically primes our brains with dopamine or serotonin when we experience a trigger in our environment, it makes it harder for the person to say no when they experience those triggers. It doesn't make it impossible, but it makes it harder. So people with substance use disorders, they still have a choice and some self-control, but that is compromised. So it's not necessarily a willpower problem. And then the next one is addicts cannot be treated with medications. There are new medicines that are being developed all the time to help patients with who've already had success in recovery to further curb those cravings for drugs or alcohol, reduce the chances of relapse, and even to enhance the effectiveness of behavioral and other psychosocial talk therapies. So we got antabuse, which can curb the cravings of alcohol. We got methadone and Suboxone to curb the cravings and reduce the withdrawal symptoms of opioid addiction. There's Wellbutrin that we can use for getting off of cigarettes and tobacco products. So there's so many of them out there. We even have the nicotine patches. That would be a form of medication to help people curb cravings. So medication is part of treatment in addition to talk therapy. And then the other one is addicts should be punished, not treated for using drugs. And we've seen over and over again that this just does not work. Science demonstrates that the changes in the brain cause people with the drug or the alcohol problem to have impaired control over their use of substance. So, talk therapy, treatment, and in some cases medication is much more effective than punishment. So if we just lock them up and throw away the key, when they get out, they're just going to go right back to using, and it's not really an effective thing to just lock someone up instead of treating them. And then the last one is some people just can't change. I'll clarify, it's not some people won't change. The myth is some people just can't change. And so we need to kind of change our mind frame on this. It's not that people can't change, it's that they won't change. And research shows that the more times you attempt to make a change, the more likely you are to succeed. And with each change attempt, you're learning more about yourself and what works and what doesn't work, and you're gaining confidence and from those strategies that are helpful. So when it comes to nicotine addiction, there's over 42 million former smokers that shows that addicts can change. So I want you to think about the myths that you've been told throughout your lifetime. What are they? What have you heard? In what ways have these myths affected the way that you think about substance users or treatment? Does this information that I gave you today change the way that you think about your potential for a successful change?